Welcome to Philly Live. I'm Sheila Watko. June was Men's Health Month, an important reminder for men to make their health a priority. A lot of guys you know may be guilty of avoiding routine care, skipping annual checkups, or waiting until a problem becomes too serious to ignore. Joining us today is Dr. Riccobene, Vice President of Clinical Care Transformation at Independence Blue Cross, to discuss why so many men put off preventative care and what that can mean for their long-term health. So welcome back, Dr. Riccobene. So good to have you back on Philly Live. Always love talking to you.
I'm so very happy to be here. You did a wonderful job, by the way.
Oh.
I don't know if I have to talk anymore. You nailed it. But I am happy to talk about this because men and women do approach their health care differently. And the reason is that men tend to have been conditioned to be more self-reliant until they have symptoms or something urgent happens.
That makes sense.
And that is something that is concerning, and because men die on average 5 years earlier than women, and a contributing factor is that they delay health care.
What would you tell men who do put off going to the doctor a lot of times until it's almost too serious?
Right. So just what I was saying about their need to feel reliant and delay care, I think men need to approach health care differently and say, I'm going to my physician for a health assessment so I can perform at a higher level for myself, for my family, for my work. And I think restating it like that gets them more engaged. And so that's what I encourage men to think about it. A good way to do that is having a relationship with a primary care doctor. And men can go to primary care doctors and they can go in for a health assessment and talk about their physical fitness. They can also go in and talk to the primary care doctor about sexual health and the questions that they have.
What should men know about getting health advice from online, from websites, and now from AI?
Right. So this is all about health literacy.
Yeah.
Not all healthcare sites are equal, and to look for reputable sites, so helpful to look at the source. So for instance, if it's the CDC, NIH, medical or professional health societies, or your local healthcare institutions have good, reliable, evidence-based sources of information. There are red flags. Because you know that basically those pop-ups, they're wishing you miracle solutions. They give you a sense of urgency. They're promoting a product. I would recommend men be careful about that.
Let's shift to mental health as well. Have you noticed that more men are seeking support in mental health care?
The answer is yes there.
Okay, that's
good. Women tend to seek more mental health care than men do for the same reasons.
Okay.
The thing that happened during the pandemic, it kind of reframed because it was such a universal phenomenon. Some of the stigma that was associated with behavioral health fell away because we all suffered stress during that time period. So people became more usual to think about seeking behavioral health, and also during that time where telehealth became available. And connecting to care, as I mentioned, is much more easy. And if you have difficulty, you can always call your health insurance company and ask. And so I know our company can actually connect you to care within a week. So there's much more access for that.
That is great to know, because sometimes it can be hard to find a care provider that you like or would like to work with or that takes the coverage. So that's really helpful and kind of proactive in helping people be proactive with themselves.
And just in general, for physical and mental health, so for your whole person health, going and using your self-scheduling tools is actually becoming much more easy. And I was actually talking to people as I came up here today. Go on, look at your self-help, or go old school. Take the time, sit in front of a calendar, call.
I'm so glad we're talking about it and hopefully encouraging some of our viewers to go do some preventative health care.
And if I've done my job, men and the women who love them are actually actively taking notes and saying, yes, we're gonna take that action.
That's wonderful. I think this is such an important conversation to have. I'm so grateful to you for being here and talking with us about this. So thank you so much for joining us, Dr. Riccobene. And to learn more for our viewers about men's health, you can visit IBX.com.
Thank you, Sheila.
Thank you for being here.